The following program on PBS Fort Wayne is made possible in part by...
It's a new day at Parkview, another day to rise up and make life better for those around us. Whether that means pushing the boundaries of what's been possible, taking big strides, or sitting with a patient long after a shift has ended. At Parkview, we don't just do what's expected, we do what's best for you and your family. And we're determined to do it even better tomorrow. Every person, every day. That's the kind of healthcare we believe in. Parkview Health. We believe in better.
And good evening. Thank you so much for watching HealthLine on PBS Fort Wayne. I'm your host, Mark Evans. And a very interesting subject tonight, something I'm sure that you've also heard about from time to time. And we're talking about long COVID syndrome. We'll learn more about the virus and how it could be controlled and how you can feel better if you have it. We have a very special guest, his first time on HealthLine, Dr. Kenan Alibegovic.
You got it, sir.
All right, thank you. Ding, ding, ding. Give me some brownie points. All right, great to have you on the show.
Pleasure.
And I know just from talking in the green room and also right before the show started, this is going to be a very interesting conversation. And we want to open up our telephone lines. The telephone number is right there on your screen. Please call anytime in the next half an hour because it is a half an hour show and we don't stop down for commercials because we are a public television. The number is 866-969-2720. Get those calls coming in because the good doctor here is more than willing and anxious to answer those for you. Let's go ahead and get started here. Do you have any stats currently on the top of your mind about how many people are still dealing with COVID even after they thought they were over with it and now have long COVID? Or, I mean, is that a pretty common thing these days?
Mm-hmm. So the updated stats that I have looked at was based off a meta-analysis that included about 50 studies across 22 countries that showed that from that population of approximately 1.2 million people, that roughly 6.5% of people experienced long COVID symptoms. Now, what is long COVID? You could easily say that it's anything that lasts more than 4 weeks after your first positive confirmation, but we really don't call it true long COVID until it's more than 12 weeks or 3 months.
Oh, wow.
I say that because there's a whole separate topic we'll discuss later called post-viral syndrome that can occur with any viruses, but for COVID, we'll say specifically more than 3 months.
All right.
And in that time frame, the people from that 1.2 million from all the studies, like I said, 6.5% met them. Those were the people who had symptoms for more than 4 weeks. And then of those people who had it past the 3 months cutoff that I just mentioned, that was 15% of that, so a total of 1%. So we'll roughly say about 100,000 people in that 1 million population had long COVID symptoms.
Wow. And I read today it could not only last months, but even possibly years. Is that correct?
Correct. That is very rare by comparison. Most of the time, another statistic I found is depending on if you have to go to the hospital or not, the average amount of time people experienced long COVID symptoms, if you just have an outpatient infection, you don't have to be hospitalized. Typically around 4 months, the symptoms last. And then if you're hospitalized, up to 9 months. Beyond that is more rare, but again, it does happen to people, as I've seen in my own clinic.
All right, well, we're going to talk about long COVID syndrome, but we need to talk initially about COVID-19, what started the whole thing, and it is a virus. So what exactly is a virus?
Oh, they're insidious, annoying little things. So just like how our cells have a little body and DNA in them, viruses are actually not considered living beings. So when you think of all the kingdoms of animals and how there's like all the different family groupings for crabs, spiders, fish, so on and so forth. Viruses are completely outside of that. It's considered a whole nother domain, which is just the virus domain. The reason why they're different and not considered living is because they need another living host in order to reproduce. Everything else that we see around us, bacteria, protozoa, plants, all of them can reproduce on their own capacity, but it's a virus. It has to infect you, use your own DNA mechanics to make more of itself.
Okay.
And so it's insidious in the fact that it actually has to get into us and replicate, and that's how they keep going on and how they've kept going on since things were created on this planet.
Well, and since this is kind of one of your specialties as a family medicine practitioner, the layman, or the person like me who gets information bits and pieces when it's force-fed to me or if I find interest in it, but you're staying on top of it. Have they gotten to the bottom of how the coronavirus actually originated?
There are two leading hypotheses, and I do think both of them are valid, just based off how some of the other viruses have occurred, especially like when you think of bird flu back in, I think, 2009.
Yeah.
That was a subset of influenza. You can have things pass from actual animals to humans, just like how HIV originally passed from primates back in the 50s. So it is very reasonable, especially with the bat hypothesis, that it could have came from an animal somewhere in Wuhan, China. That's reasonable. And then based off some suspicions, could it have been lab manufactured? I don't like to speculate on that too much, but the evidence that they show, I can't immediately dissuade it because I'm not a virologist.
Right, but it is very possible, though.
I'm more leaning to the bats, but yes,
Yeah,
I
would
say it's
rather
possible.
do that. Yeah, but the truth is the truth, and we'll find out what the truth is, I'm sure, eventually. Who knows? Tomorrow? 10 years from now, who knows? But anyway, hopefully we will find out. So we've got the coronavirus, COVID-19. A cold is a virus. So are there any similarities there between the two, even though some of the symptoms are the same? But I mean, is it just a whole different ball game between the two?
I actually wanted to talk about two of the more common ones, which include influenza, the influenza virus, and then all the cold viruses. There's over 1,000 viruses that can cause the cold, but I specifically will say that it's the rhinovirus family, as in the viruses that affect our nose. So going back to what I mentioned about viruses, they are essentially a little protein capsule, kind of like how our cells have a little membrane around them. They're made of little proteins, and then inside the proteins is some combination of single or double strands of RNA or DNA. And if you recall from middle school, DNA is what our nucleus always holds, and then RNA is essentially what our DNA can make to get sent out to make proteins for the rest of our body. So viruses can encapsulate it can look like the native DNA that we have, or it can look like that other RNA. Now, why do I mention that? Because of those three viruses we just mentioned, coronavirus, influenza virus, and the rhinoviruses, they're all considered RNA viruses. What that means is, unlike the DNA viruses, who actually have to get into our nucleus to hijack them, they can actually go a little bit past that, which makes it easier for them to replicate themselves. Because sometimes, not every single virus, not every single variant, but they can usually get into the bodies of our cells and just use all that native protein building processes to start making more and more viruses for themselves.
Okay. Let me bring up bronchitis. Is that a virus?
Very commonly, I say, because there is a bacterial bronchitis, but it's most typically a viral bronchitis.
Okay, so if you have a viral bronchitis, antibiotics would not help at all.
Not technically. There is one common antibiotic that's prescribed often for a bronchitis, known as azithromycin.
Yes.
It has some anti-inflammatory properties. I hate admitting it, but it's one of the reasons we use it for our COPD patients, even if they get viruses, because it can cut down the inflammation they have in their lungs. I don't prescribe it for bronchitis because, again, there's enough antibiotic resistance in the world, and azithromycin is a very good drug.
Yeah.
It works on things related to TB and all those other very special types of bacteria.
Well, I get bronchitis, it seems like every other year or so, and
Very common.
that's one of the first things that my physicians have prescribed is azithromycin.
And it's very doctor dependent.
Yeah, and it works, but yet, if I have a relapse, they never want to extend that. It's like, well, let's just write it out. I guess that's probably one of the best things to do, is just let the disease or your symptoms write out. Is that correct?
Correct, because there are usually other signs if it is a bacteria, that it's a bacteria. Typically an elevating fever, you're feeling very fatigued or unwell, your oxygenation status is starting to go down. There's red flags that I always personally look for, specifically when it comes to sore throat. Like when someone has a viral sore throat, you can tell they're feeling a little crummy, versus when I've seen people with strep throat, they look like they're on death's door.
Yeah, and what can you do for strep throat? A little sidebar here.
For regular strep throat, which is bacterial, antibiotics,
Okay.
they work wonders for that.
Okay, very good.
For viral strep throat, my best friend is usually some kind of ibuprofen or Proxen, if you can handle it.
I see. And then again, just let it ride itself out. Okay.
Treat the symptoms.
Treat the symptoms. Now, I'm a history buff, and one of the questions here I have is relating to the Spanish flu of 1918. So how did COVID-19 become like a pandemic, and how does it relate to the previous pandemics such as the Spanish flu?
Going back to the three viruses I mentioned. So how long have viruses in general been around? It's kind of like asking how long has the first wolf been around? You know, we know all of its ancestors, we know how long it's been with us, but we don't quite know how it's been there. So I kind of say the same thing with viruses. Most of these viruses have probably been around for billions of years, ever since life started on the planet, but they didn't become prominent until they really hit pandemic level. So for instance, when the rhinoviruses, they're never pandemics, they've just always been around. You know, they're the common cold that's been since recorded human history. The influenza virus has actually been, they speculate, has been recorded all the way to 6000 BC in China, based off how some of the symptoms they described in a pandemic that happened at that time.
Wow.
So there have been pandemics for all of these happening over and over again. The coronaviruses didn't become popular until the 1920s, when they were first a bird-based virus. Not to say that they weren't humans, but it was most noticeable then. And then in the 1960s, more often different types of coronavirus pandemics happened. Relating to the Spanish flu, there were pandemics before then and epidemics in little localized areas, going as far back into the, I think, 1700s, definitely the 1800s from what I read. And then the Spanish flu was notable just because it was the start of, have you ever heard of the term Hinny? When they talk about like bird flu, H1N1.
Oh, yeah.
So that was the start of the prominent H1N1 variant of the influenza virus, and it had a change in the H and the N stand for different parts of the virus that just make it more virulent, get into your cells, stick around longer. And after that happened, it just blew up kind of like the coronavirus did its damage, and then has been sticking around since then. And it's not always the predominant one that we have during flu season, but it is one of them, and that was the setting event that made it more predominant, kind of like how we now have SARS-CoV-2 amongst all the other coronaviruses.
Yeah, and you just hit the nail on the head there about the different varieties of the COVID virus that there are, and I'm sure it's not stopped yet. I'm sure, because what do you call it? They branch off into other things and become more resistant?
There is a term that is skipping my mind now. It is either genetic drift or genetic shift. And so they do not build up resistance. They actually, because they're little pockets of DNA and RNA, they can actually just shift their whole buildup around much quicker than bacteria can. Bacteria build up resistance by actually developing things on their bodies that either stop our medicines or change how they stick onto things. Viruses just completely warp. And that's only certain viruses. I say that because earlier before the show started, we were talking about the RSV virus.
Yes.
There's a reason why the new vaccine for the RSV virus is just one, because the RSV virus has not mutated significantly compared to when we've been studying it, versus flu, which every year is its whole nightmare.
Yes, absolutely. And I've got to get my RSV shot. I'm so glad we had this discussion. Okay, well, we have a call coming in right now, and it looks like Michelle, who prefers to be offline, and that's great. That's just fine. We'll transcribe your question for you if needed. She's asking, are blood clots a symptom of COVID or the vaccine? Very
touchy subject. So there have been a lot of symptoms reported with the COVID vaccine, and I can't deny that the vaccine may not cause certain symptoms, but when they compared, like for instance, it wasn't blood clots, it was the cardiac inflammation. There was a certain type of inflammation of the heart that was affecting young men and athletes who got the vaccine. And when they compared it to people who get the COVID virus, they found that the rates of getting it from the COVID virus were much, much higher than just from the vaccine. So in a way, it's me saying that yes, in very rare instances, the virus can cause symptoms, but you have a much higher chance of getting it from the virus itself, because the viruses can cause symptoms across the board. So to answer your question, Michelle, and thank you for that, more often than not, it's the COVID virus that will cause the clots, and I've heard of only one instance personally where a vaccine was associated with an immediate clot within about 2-week frame after they got it.
All right. We are talking to Dr. Alibegovic, who is a family medicine practitioner, and we're talking primarily about viruses and specifically more about COVID-19 and long COVID. So if you have any questions, please call the number on your screen, 866-969-2720. All right, let's move on here. So got past the comparison with the Spanish flu of 1918. You touched on this rather briefly at the beginning, but it is a question I'd like to know. We talk about viruses and how they affect you. A lot of people think you get a virus, it's all up here and maybe here, but how do viruses actually affect our bodies?
Oh, I wish I had a blackboard to demonstrate it, but if you think of your cell as a nice little circle, the virus will actually attach to your cells and make a little bleb. The fancy term for that is endosome, so it's almost like it develops another bubble inside of your cell, and from there it starts to inject its DNA into your DNA, or it lets its RNA float around your body and it just starts replicating, and from there it causes cells to burst, more viruses go out, it spreads out. The whole process starts to repeat itself. For as long as the human race has lived, our body actually does have a pretty good immune system response to it. So out of all our white blood cells, we have a very specific type called lymphocytes. Lymphocytes can treat a couple different things, but I always consider them very specific for viruses, and so that's typically our body's response to the infection.
And not your organs are affected by the virus. Is that correct? What organs are most non-defensive, I guess, or which ones are going to be attacked first?
Difficult answer because it depends on the virus.
Okay.
So like, for instance, the rhinoviruses are typically sinus or ear, nose, throat based because sometimes they can cause ear irritation. Essentially, wherever the mucus is for that affected organ system, it can affect it. There's certain types of things like the norovirus that affect mostly our GI tracts. So unfortunately, no easy answer for that. It can affect just about everything. It's very viral dependent. COVID was infamous because it got to everywhere.
Okay.
Everywhere.
And what is the virus that attacks the liver?
Hepatitis.
Hepatitis, yes, of course.
The hepaviridae. I think it's specifically the viruses for hepatitis. Yeah.
Okay, well, I'm going to stick with hepatitis if you don't mind.
Please.
Okay, all right. Now, not only physical, and we do have another question coming in. David, hold on just a second. I want to go ahead and get this question out of the way, but physical. But the long-term COVID and just COVID-19 in general can affect not only your physical self, but your mental well-being. Is that correct?
Correct.
Yeah, and we're talking about brain fog and what other happens sometimes?
The three main symptoms for long COVID are what I consider the systemic, the neural, and the respiratory. So specifically, it can affect your breathing patterns. And if you have any need for oxygen after it, it can affect how you think. That's the mental fog. And then the systemic symptoms are fatigue, muscle ache, mood swings, things like that.
Okay, all right, yeah. All right, let's go to line 5. David is preferring to stay offline, and he's asking, how do we see AI helping in the battle of viruses?
I'm actually excited for AI because it can make my job a lot easier.
I'm sorry, I chuckled a little bit, but I was trying to see what the correlation is, so I'm interested in this.
I think I could piece a little bit together. So AI is nice because just like if you've ever seen ChatGPT generate a draft for a play or for a movie, you look at it and you read it and you're like, that's a little funky. You know, like the general premise is there, but that's a little funky. They've been using AI to do things such as read radiograms based off what a patient's symptoms are. They can take the symptoms, write them down in their internal memory banks, and then put it on like a registry to see, it's more likely this symptom versus this. It can be caused by this. It's this syndrome. It's neat because if we find some way to incorporate AI to our day-to-day, not only will it help me prognosticate or pick specific diagnoses for my patients and to see how long they'll be affected by it, based off their symptoms, I could actually tell if someone's having viral versus bacterial infections.
Okay.
Can't see that happening anytime soon, but yes, I could see that viruses could end up helping us.
Well, I guess that would be helpful. Yeah, absolutely. All right, well, let's move on. You had COVID-19, struggling a little bit. How do you know you have long-term COVID? How is it diagnosed?
So first, I always recommend that people have some confirmation of having SARS-CoV-2. Specifically, it could be maybe you didn't get a test to confirm it, but you had a close exposure and you had these symptoms. We can say more likely than not, it's if this was some other disease, I would say that we could diagnose it empirically, just based off like how the logic flows together. So at least knowing you had COVID or were likely exposed to COVID is the first thing. And then you would have the correlation of 3 symptoms I mentioned previously, which is It could be mental fog, it could be issues breathing, or it could be systemic symptoms such as fatigue and muscle aches, and those will have to last more than 3 months for it to generally be considered long COVID.
And what about risk factors? Are there any age groups, or is it possible one particular gender would more than likely have long-term COVID?
For the first part, I did not write that down because essentially if you are older, sicker, more chronic diseases, smoker, intravenous drug user, anything that predisposes you to bad health will predispose you to have long COVID symptoms. From the little bit of statistics I saw, it was generally younger Caucasian women, unfortunately, that were more predisposed to get it.
Now, I wonder why.
There's so much I can speculate on difference between the sexes for all kinds of diseases, but I don't have an answer for that one. Sadly.
Okay, well, maybe we will have some research done and we'll get that answer sometime, which will be valuable to you and everyone else as well.
Yes.
All right, so is there a specific, well, I'm just going to set you up here so you can answer this question. How long does long COVID syndrome last?
Ooh, fun question. So we were discussing it early before the show started, but essentially there is a rough average, and it's based off of first if you had an infection where you didn't have to go to the hospital, what we call an outpatient infection, so you just went home or just got to see the doctor, and then an inpatient. For most outpatient people who have symptoms of long COVID lasting more than 3 months, the average amount of time is 4 months. I could say specifically for myself, I definitely had long COVID symptoms where when I couldn't exercise the same way I used to, and it took me 3.5 months before I got to my baseline. And that was, I had an outpatient infection. For inpatient, it can take upwards of 9 months on average. And then there's a very rare subset of people after that who it goes well beyond that, and that is possible.
Okay.
Years even, unfortunately.
Folks with diabetes or heart disease more prone?
Yes, diabetes more so, heart disease, I would assume so.
Yeah, okay.
Diabetes specifically because it affects your immune system.
I would see that. I could see that. We have Anthony on the phone. He's asking, do masks work against viruses?
The answer is yes, partially. So the best mask is the N95. It's specifically made to avoid certain bacteria and viruses of a certain size. Masks otherwise in general, people compare it to like if you put a tennis racket over your face, like will that actually stop anything hitting it? And the answer is yeah, a little bit. So I'm usually a pretty good advocate of wearing masks because it will decrease your chance of catching the virus. It's just not always the best way to do it.
Well, and during the COVID-19 pandemic, we had several shows right here in this studio, and they were an hour long, and we had several guests. And it was still fairly new, fairly fresh. So the coronavirus can still be transmitted through the air. Is that correct?
Correct. Very specifically droplets.
Droplets.
So the reason why I say that is because you don't have to be spitting on people to be passing it. They could be microscopic droplets.
I see.
Because there's a big difference versus if you have COVID versus if you have tuberculosis. Tuberculosis is considered airborne. Do not be in the same room as that person.
Okay. And what about the hand sanitizing? That was a big thing.
Oh, no. Very helpful. The very small subset of viruses don't respond to that, and it's typically the stomach viruses. Those you have to do soap and water. Otherwise, hand sanitizer does help kill most of the respiratory viruses.
Okay, that's good to know because you can't believe everything you read. But
unfortunately.
Yeah, so some of those things, but you did verify the positives on those, and thank you for that. Your hypothesis of the future treatment or research of the COVID virus.
I wrote down a couple of them just based off studies that I've been reading. So they're looking into different kinds of medications, and some of them are very benign, some of them are more serious, but just to see if there's some way to treat it. And that's based off the hypothesis is long COVID more inflammation, viral persistence? Is it more damage to the cells? So they're trying all kinds of different medicines to see if that works for that. They're trying a set of NSAIDs, also known as the anti-inflammatory, so that's like ibuprofen. It's not specifically ibuprofen, but cousins to ibuprofen they're trying. There's also variants of blood thinners, such as Xarelto, that they're trying. A couple of antihistamines, and I mean that's simply like Claritin, Zyrtec. They're seeing if that could improve it. And then they're actually developing experimental molecules to see if that could potentially help.
Now how would that work?
I have no clue. Some of those stuff they actually make de novo, just based off some, like I said, I'm not a virologist, so it's something related to the virus that they think will work.
Yeah.
The one that I've been most interested in is, have you ever heard of the anti-diabetes drug metformin?
Yes, I have.
So they have found, and this is not after someone has after someone has COVID, it's before they have it. They've been viewing people who have been on metformin before they get COVID, and they've been able to show that them against a control population not on metformin typically has 40% less of a viral load by the time they have the disease, like 14 days later, and that they've had less COVID symptoms, like long-lasting COVID symptoms, than a control group. Now, they didn't state a mechanism as to why that works, but I thought that was very promising because metformin is such a dirt cheap drug, and I personally love it.
Okay. Well, and I want to bring something up too. You know, during the days of COVID-19, when it was all out there, I mean, it was a very dark time for us, and many people died. So what attributes to the death factor going down? Would you attribute that to the vaccine?
Both to a combination of infection and vaccine, because I don't deny that once you get the COVID virus, just like any virus, you will have some degree of natural immunity, and studies have shown that they can be comparable. Now, just like with other viral infections, I say that even if you had natural immunity, you can still get the vaccination after a 6-month period, and it'll provide you even more benefit. Like I've had some patients who've had shingles. They have an episode of shingles. They want to get the shingles vaccine. If you get the shingles vaccine after having shingles, it still provides you a benefit.
Okay. We have 30 seconds left, Doctor. If you can just let our viewers know how we can prevent getting COVID-19.
Please get vaccinated. I highly recommend the vaccine. It's one of the few ways that have been shown. And even if you have COVID, if you get the vaccine, it decreases your chance to get COVID again. And they've shown in a study of 600,000 people that those who were vaccinated had symptoms less than individuals who are not vaccinated.
Okay, well, thank you very much, Dr. Alibegovic. We truly appreciate your time, and you did a great job for being on the show for the first time. All right, continued success to you.
Thanks so much, sir.
And thank you so much for watching HealthLine tonight. We'll be back next Tuesday at 7:30. In the meantime, take care, good night, and good health.